Why am I standing here like a goon with tape on my mouth? Well, I actually want to talk to you about chronic neck pain and especially chronic TMJ and jaw pain, because so many people with this type of pain have it for a really long time, for months to years, and don't have a permanent solution for it. Well, there are actually a bunch of variables that are important in order to get it better. And I want to talk to you about what those variables actually are. And if you look over here at my trusty whiteboard, I wrote 5 really important problems to address when it comes to wanting to permanently fix the jaw pain you're having. Mouth breathing, improper mouth posture, snoring and apnea, excessive stress, throat chakra deficiencies, and also decreased flexibility. So let's just go down the list. The first is mouth breathing. Have you ever been in 2nd grade or 3rd grade and looking around the classroom and seeing certain students staring at the teacher with their mouth wide open like this? And a lot of times those same students will be people who don't get the best grades, or the teacher will say, hey, you're not paying attention. Well, it's not their fault, because actually there's a problem that's causing them to be a mouth breather. So I first figured this out about 6 months or a year ago. I was listening to a podcast where this gentleman, I believe he wrote the book called Breathing, he was talking about how, excuse me ladies, but men, in order to be healthy, virile men, no matter what age you are, you need to be waking up with morning wood. And if you're not waking up with morning wood, it's probably because you're a mouth breather. So we need to teach ourselves how to become nasal breathers. And how can you do that? First, just paying attention in your everyday life. Is your mouth closed and are you breathing through your nose? And then what I started doing a few months ago is using Somnifix mouth strips, which you can get on Amazon. And before I go to bed, I put on these mouth strips. And sure enough, after a few days of using this stuff, I was waking up with morning wood. And I wasn't doing this before I started using those mouth strips. And now when I exercise as well, I keep the intensity of my runs or my exercise low enough so that I'm always breathing through my nose when I exercise. And the idea is that you're just increasing the output and performance of your lungs. You're also increasing the amount of nitric oxide in your body. Nitric oxide is a vasodilator. And what that means is that when your blood vessels are narrow and thin, nitric oxide makes your blood vessels a lot thicker. So it increases the circulation in your entire body, hence the morning wood issue with men. So using the mouth strips, the tape that you can get on Amazon, Somnifix, and just enforcing nasal breathing is the first step in order to address the mouth breathing that makes jaw pain worse. The second part of it is improper mouth posture. Most people don't realize that your mouth should just be slightly open and the tongue should be resting on the roof of the mouth. That's how we're supposed to be maintaining our neck posture, our jaw posture. So just practice being mindful and aware of maintaining the tongue on the roof of your mouth with your mouth slightly open. That's how we're supposed to maintain that posture. The third part of it is snoring or apnea. So if you snore or have apnea, you could be overweight, you could be eating inflammatory foods. I know that when I smoke a lot of cannabis or when I used to drink alcohol, I will snore a lot. If it's really bad, you might need a CPAP machine. It could save your life by wearing it, or just fix the other health issues. You could also try sleeping on your side. Also paying attention to allergens or pollutants in your atmosphere at home in your bedroom, and try to clean that out with an air cleaner or whatever else you need to do. But this is a big issue. You want to try to do whatever you can to stop the snoring and the apnea. The fourth part is excessive stress in the throat chakra. This is very unconventional stuff, but I found some patterns to be very true. People who are very stressed out, they tend to grind in their sleep. And that's a problem. If your jaw muscles are just always contracting and working, well, no jaw pain or jaw posture is ever going to get better with that. So you need to do whatever you have to do to manage stress. We're huge believers at Barefoot Rehab of meditation, learning how to feel emotions, how to process different emotions, doing things that give you joy every day, healthy forms of exercise. All these things really matter. The deeper aspect to stress is when we have a dysfunctional throat chakra. A couple years ago, if anybody told me like to pay attention to chakras, I would be like, F you, this stuff is not real. And the more I pay attention to these things about chakras, the more my my eyes and my ears open up to possibilities. And I found, especially in our society where it's still a very patriarchal society where men dominate things, a lot of women tend to deal with TMJ issues. And why is that relevant? It's because a lot of women are still stepping up to find their voice. And so if women were growing up in a household, or even men were growing up in a household as children, and they weren't allowed to express themselves, if they were told that children are supposed to be seen, not heard, or told to shut up at the dinner table, that's gonna result in a dysfunctional throat chakra. So what those people can do is just start to make sure that they're expressing themselves, expressing their truth. Sometimes we've had some of our patients sing, or you can om, or you can chant. These are very spiritual practices, but they definitely correlate to somebody getting out of chronic jaw pain. And oming actually has the benefit of also activating the polyvagal nerve, which is very involved with people who have childhood traumas. So that's a nerve that goes from your cranium, your skull, down to your organs down below, and it gets shut off when we have trauma. So you can activate it deep behind your heart by oming. And if you do this, you're gonna start to feel it vibrate down lower in this area, not just in your mouth and your neck. So addressing stress and the throat chakra will also help the jaw start to be less active so pain can go away. And the fifth piece of this is decreased flexibility. A lot of people with TMJ pain or bad posture just can't open their mouth all the way. And that needs to be restored. The most common cause of restricted flexibility in any joint and any muscle is adhesion. It's kind of like glue in your muscle tissue. So Barefoot Rehab is the only clinic in New Jersey certified to find and fix adhesion. We will commonly look at all the different muscles that can have adhesion in it. These muscles are jaw muscles. These muscles on the outside are jaw muscles. By far the most common jaw muscles we're treating are inside the mouth. And usually when people get this treated, they're like, oh my God, I can open up my jaw all the way. But there are all these other little muscles underneath the chin and the neck and even in the back of the skull that all will affect jaw posture and jaw pain. So if you really want to get permanent relief for your jaw pain, these are the things that you need to get checked, and check them all off your list as you're working through them so that you can make sure that you're not leaving any stone unturned when it comes to living a healthy, pain-free life. So I look forward to seeing you being able to open your jaw and looking as crazy as I did with that tape on your mouth. But just tell your partner, don't worry, Dr. Chris at Barefoot Rehab said it's for your health. It's okay. And in a few weeks, you're gonna notice your body's healing better, you're recovering better just because you're breathing more, getting that oxygen in, and your jaw pain and posture is gonna get better too. Much thanks to our patient, Pat, who gave me a little kick in the butt because this stuff is really important and his jaw pain has affected his entire life. So much love to you, Pat.